with or known a child that is currently dealing with childhood obesity. Obesity in children can have more of an effect than we may be aware of. There are both immediate and long-term effects today, and I'd like to give you more information about that. According to the Centers of Disease Control and Prevention, it is documented that in 2012, more than 1/3 of children or adolescents were overweight or obese. It is possible that you know a child that comes to mind when thinking about this. This afternoon, I'd like to provide you with this information. Childhood obesity is a child having excess body fat and is different than being overweight, which is termed excess body weight for a specific height to weight ratio, which factors in muscle, fat, bone, or water. Now that I've told you the definition of childhood obesity, I'll inform you of the impact it has on the children that suffer with it. Childhood obesity can impact a child both psychologically and with their health. The psychological effects can lead to depression, low self-esteem, and even eating disorders. Children who are obese may suffer from depression or low self-esteem if they are not happy with their self-image, or if they have to encounter bullies at school. Childhood obesity can cause an increase in health risk, both immediate and long-term. The immediate effects can cause cardiovascular disease, prediabetes, and even greater risk for bone and joint problems. The long-term effects for obese children have a greater chance to be obese as an adult, and it can also cause heart disease, type 2 diabetes, stroke, some cancers, osteoarthritis, and all of this is stated in the CDC. Now that I've given you the information about the impact childhood obesity can have, I'd like to give you the information on how it can be prevented. Childhood obesity can be prevented from eating healthy as well as moderate physical activity. And it can lower the chances of obesity in children. Restricting sodas and junk food is always recommended. Prevention of childhood obesity begins at home, but can also be practiced by schools or daycares. Who can influence healthy eating habits and outside play? Now that I've given you information on how to prevent childhood obesity, I'll move on to my conclusion. In summary, childhood obesity affects roughly 1/3 of children being considered obese or overweight. It is commonly caused by poor lifestyle habits and in return can have health risks or issues with self-esteem. Childhood obesity and the risk can be prevented by healthy physical activities and eating habits. I hope you gained some beneficial knowledge about childhood obesity.
Where is Xander anyway?